And good evening, everybody. Dr. Peter Glidden, your steadfast advocate for health, back from vacation, or, a week away, or rose by any other name. Thanks for being here. Today is the 24th day of June, 2025. This is my live Q&A for my subscribers and their lucky guests. If you are watching this on YouTube, you can join in these reindeer games by navigating to leavebigpharmabehind.com, leavebigpharmabehind.com, and become a subscriber. I broadcast this on YouTube to give you a taste of what you're missing, to give you a behind the curtains look at how real medicine is practiced here in the not so free 21st century medical market. If you find my information compelling, then please navigate to leavebigpharmabehind.com and become a subscriber. And then you can ask me questions. And we do this twice a week, 1 hour every Tuesday night and 1 hour every Thursday morning Central Time. I hope that you do join me because, honest to God, everybody in the world needs to know what myself and my colleagues know. And it's it's a culmination on my behalf of 36 years of clinical experience plus thousands of hours of combined clinical experience of my colleagues going back hundreds of years. I mean, it's a lot of information, of which I find myself the tip of the spear in the 21st century. Thanks so much for being here. Uh, the world that we live in is a mechanistic world. It is an atheistic and a mechanistic world. And because it's an atheistic and mechanistic world, medicine fails. And medicine fails because conventional medicine, MD-directed allopathic medicine, pharmaceutical centrist allopathic medicine, is based upon a childish view, understanding of how the human body works. It's based on an atheistic, mechanistic, reductionistic worldview, which is inconsistent with natural law. This is why we have a chronic disease epidemic. It's not because the medical doctors are sadistic, money-grubbing lackeys to the pharmaceutical industry who are trying to hurt people. Some are, most, the vast majority are not. It's because the methodology that they're trained in is insufficient to the cause, because it's based on allopathic reductionistic atheism. It does not believe that the human body has the ability to fix itself. So all that the medical doctors are trained to do, all that the pharmaceutical industry does, is manufacture drugs, the intention of which is to disrupt and confound and push and disturb a certain biochemical pathway in the human body, right? Different drugs, different names, they're all intended to move a very particular metabolic pathway inside the human body in order to produce a result. But the messed up metabolic pathway is not the disease. It is the result of the disease. The tumor is not the disease. It is the result of the disease. The enlarged heart is not the disease. It is the result of the disease. The fibroid, uterine fibroid, is not the disease. It is the result of the disease. The overabundance of, or the lack of serotonin in the brain of someone who's depressed is not the disease. It is the result of the disease. And so when you only manipulate the biochemistry of the body, which is an unbelievably complicated thing, it's an unbelievably complicated thing, you're going to screw things up. You're going to have unintended consequences because everything's connected, and you're never going to get to the root cause of the problem. And that's why all of the drugs that you see advertised on TV all of the time have all of these side effects. It's because it's like throwing a wrench into a complex set of gears. Oh, and don't worry, we're going to develop a drug for the side effect of this drug, and you don't need to worry about that. Just shut up and do what the doctor tells you to, because he went to Harvard and is trained in the best medicine that humanity has to offer, and that's simply not true. The wheelhouse of conventional medicine is surgery when it's necessary in trauma care. And if I was a medical doctor, that would be the only thing that I would be comfortable doing because that's what the MDs are good at. However, if the MDs were to marry the surgical procedure with the naturopathic therapeutics, the recovery time of the patients would be cut in half. The amount of pain meds that would be necessary would be cut in half or 75%, and everything would be better. But that's never going to happen because the world is run by the pharmaceutical industry. The pharmaceutical industry, I would argue, is evil at its core, and I'm choosing my words carefully, but whether you believe that or not is irrelevant. The only thing that you need to understand is that since 1912, we have existed inside of a medical monopoly. The medical monopoly, which puts the MDs in first place, outlaws every other type of medicine, passes laws which say that the only thing that can treat a disease is a drug. So that's why if you go to the health food store, it doesn't say asthma RX, it says lung support. Because if you sell a non-drug substance and link it to the treatment of a disease, that's against the law. Did you know that? Who's that good for? That's good for the pharmaceutical industry. It's a lock from start to finish. It is a financial and emotional, intellectual lock on medicine. And it would be good. One thing if they got results, but MD-directed allopathic medicine is the leading cause of death in the United States. It's the leading cause of bankruptcy in the United States. And since they've been in charge of everything, our health is getting worse. Chronic disease is escalating. Everybody understands that. But nobody understands the reason why. The reason why is because we don't have medical freedom. The only medicine that people have access to is MD-directed, allopathic, pharmaceutical centrist, mechanistic, Machiavellian, mediocre medicine, which does not train its physicians how to cure anything. So under their care, nothing gets cured. The can gets kicked down the road, and as time goes by, you get sicker and weaker and sicker and weaker and more dependent on the drug and more dependent on the drug. Then you get addicted to the drug. Then they take you off the drug, and then you have to find a facsimile on the street, and then you go bankrupt, and then you die. 1 out of 17 kids is autistic on the watch of the MDs in California. Oh, but that's okay. It's genetic. Bullshit, it's not genetic. It's really bad, ladies and gentlemen. And there's only a handful of us that are standing up in the public forum who have a clue, who actually have clinical experience doing this, who actually have a license to practice medicine, who actually have, in fact, been practicing medicine for decades. Curative medicine. And, we get censored and booted off social media all the time. I'm the only one that I'm aware of, that has my bona fides. So you should listen to what I and my colleagues have to say. You should listen to what we bring to the table because your life often will depend upon it. We don't have the answers to everything, but we do, in fact, have our fingers on the pulse, pun intended, of curative medicine, which the MDs do not believe exists, and more's the pity. So if that didn't get you interested to go to my website, I don't know what will. Please navigate here, leavebigpharmabehind.com. Not only as a subscriber will you have access to live Q&As twice a week, but you'll have access to hundreds of hours of instructional videos which teach you what to do to get your body into the game of healing, probably for the first time in your life. Get it? Got it? Good. Let's go to Vietnam. Vietnam's in the house. Good morning, Doc. Timestamp for Vietnam, 9 minutes and 25 seconds. I jumped boxes at the gym yesterday, accidentally fell over and landed on my hip. Now my lower back muscles are kind of locked up. Probably overstretched, sore at every movement. Would you recommend icing it or any other remedy? Yeah, I would ice it. I would ice it 3 times a day for 10 minutes each time. Ice it 3 times a day for 10 minutes each time and do Arnica montana, homeopathic Arnica montana. Arnica montana is the first thing to consider with any blunt force trauma anywhere in the body. Any blunt force trauma anywhere in the body, Arnica montana. I would get it at high, 200C or 1M potency, and take 2 pellets 4 times a day for 4 days. 2 pellets 4 times a day for 4 days. Okay? Okay, very good. West Jordan in the US is up next. It's Casey in Utah. Timestamp for Casey 1020. When doing everything right, off the bad foods and on the good foods, as well as the full dose of the 90, along with selenium sweeties, how does one wean off insulin with type 2 diabetes? What is the process of weaning off of insulin? You talk to a pharmacist, you ask them how to do it because there's a million different types of insulin. There's fast acting, there's short acting, there's all different kinds of insulin. So you need to be schooled on what to do to get off of the insulin that you specifically are on, and the pharmacist will be able to tell you that. And so you get on the withdrawal schedule and you commit to the withdrawal schedule. And you look to see, right, how you feel. There will be bumps whenever you withdraw from any medicine at all, which is a function not of your body being in a bad space anymore, but as a withdrawal from the medicine itself. That's how you have to do it. Now, while you are doing that, I would take 2 more sweeties and 4 more EFAs a day. While you're withdrawing, I would take 2 more sweeties and 4 more EFAs a day while you are in the process of withdrawing. Okay? Okay, our good friend Vinny Carotnudo's up next. Timestamp for Vincent, 11:45. Since having COVID in April, my fiancée has had persistent dryness, flaking, and redness on her lips, especially under the lower lip, with cracks at the corners of her mouth. Her lips and corners of her cheeks feel dry and tight in the mornings, worse during and after eating. She feels like she always needs thick moisturizers on her lips. She used to apply Aquaphor every hour and before bed, but has slowly stopped. Despite this, she's constantly craving moisture. No routine seems to provide lasting relief. What do you think is causing this? Well, I'm assuming she's on the 90 and taking the the EFAs, right? Because that's going to go a long way towards helping skin to be healthy. She can get the cell salt natrum muriaticum in the 12x potency, 12x natrum muriaticum. Do 2 tablets 3 times a day for 14 days. 2 tablets 3 times a day for 14 days. Homeopathic natrum muriaticum in the 12x potency. It will be labeled as a cell salt. Natrum muriaticum 12x. 2 tablets 3 times a day for 14 days. Okay? Now, it's the first thing to do. If that doesn't cut the mustard, we're going to do something else. And the remedy is called conjurango. It's the condor plant from the Andes. But first, we're going to do Natrum muriaticum cell salt. Okay? Okay, Vinny, let me know what happens. Appreciate your trust. Chicago's up next. 1325. I have a burning sensation on the entire bottom of both feet with numbness. I guess I'm developing neuropathy. Podiatrist told me I need to take 250 micrograms of vitamins B6 and 1,000 micrograms of B12. What do you suggest? Well, I suggest this. Because remember, you don't need 2 vitamins, B6 and B12. You need 16 plus 12 amino acids plus 2 fatty acids plus 60 minerals for a grand total of 90. And when you take all 90 instead of just 2, you get a much more robust response. And this is the secret to our success. This is called holistic medical nutrition. I'm the only one that's talking about it in the world on a public stage like this. There's a handful of doctors that are aware of this and that do it. But they're few and far between. This is why we get an 83% success rate, because we give the body everything that it needs, not just 2 things that it needs. We get the hell out of the way. We stop eating food that's coming up the works, and we give the body a chance to fix itself. And 83% of the time it works. So, plus your doctor has no business giving you advice about vitamins because your doctor has no training, no experience, he has little to no experience in medical nutrition. I mean, if a chiropractor gave you advice about open heart surgery, you'd think he was nuts. But when medical doctors give you advice about medicine, oh, thank you, doctor. Thank you very much. Let me kiss the ring. You should not listen to anything that a medical doctor has to say about anything that's not a drug or a surgical procedure. You simply shouldn't because they have no training in it, period. Now, the most common cause of this particular symptom is metformin. So if you're taking metformin, that's probably why you have this. And do you know how metformin works? You don't? Well, nobody does. Isn't that interesting? Metformin, one of the most widely prescribed blood sugar medicines in the world, doctors have no idea how it works. And I'm the quack. You got to be kidding me. Tremonton's up next. Timestamp for Tremonton, 16 minutes on the button. In regards to swelling of the ankles, it seems to only happen when standing barefoot on a flat, hard surface, but not at any other time. I've still been using the de-stress and increase in protein. What more can be done? Well, so then it's venous insufficiency. Now, if it's venous insufficiency, then you need you need some gemotherapy remedies from Canada. So call my office tomorrow, 855-347-3696. Tell my office manager, Bob, you want the botanical medicines for venous insufficiency. You want the botanical medicines for venous insufficiency, and I'll hook you up. Okay. Second question. I weigh 226, but on the nutrients for a while. I've done intermittent fasting for a while, and I got used to eating once per day. Is this hindering weight loss? No. Remember, with weight loss, it's all about calories and mineralization. So if you are attempting to lose weight, you need to decrease your calories and increase your minerals. And remember, with calories, it's about the net caloric intake every day, how many calories you're consuming versus how many calories you're burning, right? And prescription drugs will mess it up. Prescription drugs will mess up weight loss. They will. You need to get off your prescription drugs if you're on any as fast as possible, safely. Gross Point is up next, 1740. Hey, Doc, welcome back. Thank you. I hope you had a wonderful vacation with family. I did. I'm on the Healthy Foundation Pack, EFA, several good herbs, and microbiome. I'm off the 12 bad foods, an update on my gas diarrhea issues resulting from the osteo powder. I did the individual 3-day elimination you suggested. You were absolutely correct. Ha! I love it when I'm correct. Did you hear that, honey? The Osteo FX was the problem. Yeah, most of the time it is. I restarted it, but at half a scoop. In 2 days, I was having problems again, so I stopped it for 3 days. Then I started with a half a teaspoon once a day, and then switched to taking it after a meal, and I still have problems. I've stopped Osteo for 3 days. Tomorrow, I was planning to take the half teaspoon after a meal once a day, then stop it for 3 days, and increase ever so slowly. Yeah, it's not anything in that supplement that's the problem. It's your body's inability to absorb it. And your body's inability to absorb it is a function of wheat, barley, rye, and oat consumption over your lifetime. Gluten in grains is the leading cause of destruction of the small intestinal villi, whose job it is to absorb nutrients. So this needs to be a wake-up call for you that you need to absolutely, positively not even look at the 12 bad foods. And you're like a canary in the coal mine for this. So you're very sensitive to this. It's a good thing we figured this out now, right? Because there's some people, there are different levels of sensitivity to bad things, right? You apparently are very sensitive to gluten because otherwise you would not have a problem with the osteo effects, but you do. So you really, 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 really need to not even look at that anymore. Zero tolerance for wheat, barley, rye, and oats, period. And I would also schedule 1, 2, 3, 4 colon hydrotherapy sessions inside of 3 weeks. 4 colon hydrotherapy sessions inside of 3 weeks. All right. And I would also do the 7-day detox, which is outlined. It's Sharon from Michigan. Yeah. So do the 7-day detox, which is outlined in the medical insight section. And if you can swing it during that time, have a couple of colon hydrotherapy sessions. Okay. It will help. Time is your biggest friend here. Time is your biggest friend. Um, Time is your biggest friend. Okay. Okay. Australia's up next. That dingo ate my baby. That dingo. That dingo ate my baby. Timestamp 2050. Following your recommendations, we have a 75-year-old customer with macular degeneration. She's been on the protocol for a few years, but her eyesight is now declining very quickly. She's been on the brain and heart pack, Z radical, collagen peptides, and a lot of other things. What do you recommend, please? Well, you know the drill, right? When somebody does the generic stuff and it doesn't work, it does not cut the mustard, then they need a private appointment. And that's how it works. And 83% of the time it works. But 17% it doesn't. So there's something going on. Something needs to be fine-tuned. And so the next step would be a private appointment with me. And, I treat people virtually all around the world, so she doesn't have to fly to the United States. We have another customer, 75-year-old man who's been through prostate cancer, which helped him deal with using natural methods, no chemo or radiation. He's been on androgen therapy. Yikes. As doctors told him, testosterone fuels prostate. It brought his PSA significantly down from 280 to 0.65. However, his PSA is now creeping back up. The doctors did say that androgen therapy will only work for a time as the body gets used to it. He's wanting to know if there is some natural food-based product that can suppress testosterone. There might be, but that is not what I would recommend. Because that's allopathic reductionistic mechanistic treatment. He doesn't have prostate cancer because he has testosterone. He simply doesn't. The medical doctors are wrong. The testosterone might be making it worse, but it's not because he has testosterone that he has prostate cancer. So they're barking up the wrong tree, and eventually that therapy will fail, which it's starting to do. So anybody with cancer needs a private appointment with somebody like me. And remember, we don't treat cancer. We don't treat disease. Period. It's impossible to treat disease. You can't do it. We can treat people who have been told they have a particular disease, but we don't treat the disease. We treat the person. There's a gigantic difference. The treatment always needs to be individualized for things like this. So there's nothing else for him to do except, I have a colleague in Montreal who I would highly recommend, or he could come and see me. Okay. My colleague in Montreal treats people virtually. He's the go-to person right now in the world for anything with cancer. We have a 17-year-old boy who had a concussion in November. He got sick in February with COVID-19. No, he did not. Nobody got COVID-19. He's unvaxxed. When the COVID symptoms lifted, he had severe brain fog and all his senses were affected. Visually, he explained it as if he was dreaming, but he was awake. And at that time, he had to sleep 18 hours a day. Fast forward to today, he has brain fog, which occurs on the back of a viral infection when his immunity is taking a hit. He's never had a viral infection in his life. His speech slows. It affects his vision. His eyes flick. It takes his ability. Okay, so his mother said it. Okay, so anybody that has anything whatsoever, you put them on this. This is step number 1, step number 2, step number 1, step number 2. Step number 3 would be this. Homeopathic carbonium oxygenosatum in the 30C potency. Have him take 2 pellets orally 3 times a day for 14 days. 2 pellets orally 3 times a day for 14 days, and then get back to me and tell me what happened. But this is mandatory. This is mandatory. Okay. He's got to strengthen his body against the stress of life. The reason that people get long COVID has nothing to do with the COVID virus because nobody's ever proven that the COVID virus ever existed. It might exist. It's never been proven. Bigfoot might exist. I believe in Bigfoot, but it's never been proven. COVID-19 was never proven to exist. Period. Hard stop. End of story. It may exist, but nobody proved it. And a lot of people should go to jail because they published fraudulent research that the esteemed members of the medical community, the grand poobahs from Harvard, all gave a pass to, and it was laughable. It's like me saying, "Oh, I have proof that Bigfoot exists. Here's a composite sketch. We interviewed 1,000 people who said that they saw Bigfoot in their life. We had them describe it to a sketch artist, and here's what Bigfoot looks like. That's proof that Bigfoot exists." That's what they did with COVID. It's a little more complicated than that, but that's basically what it boils down to. I think COVID was caused by 5G radiation. I think that's what the symptoms were caused by. That people then habituated to. The same exact thing happened to starlings in England about a year before COVID. But I digress. So, this, and this for the kid, okay? Don't get caught up in the whole virus thing. Don't worry about that. You don't need to worry about that because that's not a thing. The health of the body is the thing. This internal strength of the body is the thing. That's what we need to be focused on. Not worrying about miniature little particles that scientists have speculated exist. Maybe they do. A lot of viral jargon just does not make sense. It doesn't make sense. It's become reality by consensus. But again, I digress. Okay? That's what I want him to do. And fire his goddamn medical doctor immediately, please. Oops, we're getting a lot of people whose chats have expired, and I don't know why. Okay. We have someone unknown with a question about a checkup they got. Timestamp 2810. My MD ordered an annual checkup, and my potassium levels came up high. She said the range is 3.5 to 5.1. Mine was 5.3. Should I worry about it? No, you should not. Yeah, I've been taking the 90 for over 2 years. It's the only source that I can think of why my levels could be high. Thank you in advance for your feedback. It's not. You don't need to be alarmed about sodium levels like that. You only need to be alarmed about sodium levels when they're above 7 3 times in a row. When they're above 7 3 times in a row. Okay? Don't worry about it. It's a non-starter. Excellent question, though. Barbados is up next. The timestamp for Barbados, 2850. Is it safe for a female to have a pap smear done? Yes. Is there an alternative test to a pap smear? Not that I'm aware of. Should a female get tested for HPV? No. Do not get tested for HPV. It's never been proven to exist. And, I used to be really careful about saying stuff like this in the public forum because it sounds like, Dr. Glidden's gone off the freaking deep edge and now I'm not going to listen to anything else that he has to say, but I don't give a shit anymore. You want to believe in this stuff? Go right ahead and believe it. But what you should do is get a book. Do I have it here? It's called Virus Mania by Torstein and Engelbrook, I think. Virus, I don't see it here. It must be upstairs. Virus Mania. Pick up a copy of Virus Mania and read it. And your freaking head will explode 20 times. No. So the answer is no to the HPV. The answer is yes for the pap smear. Okay? The answer is no, a hard no for anything that the medical doctor tells you to do if the pap smear comes back with a negative reading. If the pap smear comes back with a negative reading, you talk to me. You do not do anything that the medical doctors tell you to do. We use them for diagnostic purposes only. And most of the time, the diagnostic procedures and tests that they do are absolutely 100% meaningless because the diagnostic procedure gives us very little, if any, actionable intel about what to do to cure the condition. The medical doctor's job is to treat a diagnosis, to come up with a diagnosis, to diagnose a disease is the medical doctor's job. The naturopathic doctor's job is to diagnose a treatment. It's a big difference, right? So you've got rheumatoid arthritis. So that's what the medical doctors say. They don't really know what that means because the rheumatoid factor can either be present or absent, and you can still have the diagnosis of rheumatoid arthritis. So what's up with that? They never explain that. Number one. Number two, so now you have a definitive diagnosis of rheumatoid arthritis. They have no idea what causes it. They have no idea what to do to cure it. All they can do is throw drugs at it to medicate it and suppress it. That's all that they can do. So why even bother to get a diagnosis in the first place? Because you're not really any better off after the fact than you were before the fact. You've lost a lot of money. I'm going to do a whole series on this diagnostic idiocy because it is mostly nonsense. Oh, you've got rheumatoid arthritis. Oh, you've got Sjogren's. Oh, you've got Hashimoto's thyroiditis. Oh, you've got ulcerative colitis. Oh, thank you very much. What caused it? Oh, it's genetic. Bullshit, it's genetic. You have no idea what causes it, do you? It's just do what I say. I went to Harvard. Take your prednisone. I don't know why I got off on that tangent. Matthew from the Palm Coast is back. Thank God. I have a breath of fresh air. 32, get me off of my soapbox. 33 minutes for Matthew, who had a remarkable healing of a carpal tunnel situation that the medical doctors wanted a surgery. All they could do was surgery, 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 surgery. His pain was so bad, he couldn't even freaking open a door. Completely cured it in 3 weeks, 3 to 4 weeks, I'll say, with medical nutrition. No private appointment necessary, complete 100% cure. That beats a poke in the eye with a sharp stick. Okay. See, this is what happens when I go on vacation. 33 minutes and 45 seconds. Just wanted to pass you some good news. All right, let's go. 7-day detox results. The detox went great. I had 2 old childhood symptoms return separately. Well, that's really good. On days 3 and 4, then vanish in about half an hour. It was awesome. I scheduled 10 colonics, but after the 5th, they mentioned I appeared to have my final clearing, so they went ahead and canceled the rest. That's good. Maybe this is related, or maybe it's just me believing it made a difference here, but my hot feet at night has been gone since day 2 of the detox. Now nearing 2 weeks later, and I typically have these hot feet episodes every night. That's an excellent testimony. See, this is what happens when you give the body a freaking chance, which nobody does except the naturopathic doctor. But remember, not all naturopathic doctors are created equal, because since right around the year 2000, in my opinion, and many of my colleagues' opinions, the naturopathic medical schools stopped teaching naturopathic medicine, period. They don't teach it anymore. They teach green allopathic bullshit medicine, which is just bad. It gives the whole profession a bad name. but I digress. So this is what we do, right? We understand that the body knows how to fix itself. The body wants to fix itself. The body's trying to fix itself. So what do? We give the body a chance to fix itself. It's like telling people, look, you got to go shovel your driveway and it's minus 10 degrees Fahrenheit and it's snowing. Okay, you should probably put long underwear, wool pants, a heavy sweater, a down jacket, boots, gloves, and a hat, and a scarf. You should probably do that. That's all that we do. We give people rational advice about what to do to help their body deal with the stress of life and fix itself. But it's quack medicine, remember. You getting the picture yet? Fire your medical doctor immediately and seek out alternatives that are clinically verified, which support and promote the body's natural built-in God-given ability to fix itself. And, if you're waiting for Bobby Kennedy to fix this, it's not going to happen. Excellent job, Matthew. That's the hits keep on coming, right? You're going to be the poster boy for naturopathic medical success. Dan is up next, 37 minutes on the button. I talked to you on on Pastor Ernie's show. Okay, there's this pastor in Ohio. His name is Ernie Sanders, and he is the leader of the Christian Resistance, and he's a great guy. And he has a radio program, and I'm on it the first Thursday of every month, and I take calls. I don't know how that ever happened. And I feel a little funny every time I'm on his show because it's like, it's kind of like going to a gun show and seeing someone selling fishing rods. That's what it's like. That's what it seems like to me. But nonetheless, it's helping people. So here I am. All right. So you talked to me on the radio show about my achy thumb and numbness in my right arm that I thought was caused by an insect bite. It's still happening after 3 months now. You told me to keep track of my thumb is achy. Sometimes my arm is numb and tingly all the time. Do you have a recommendation for me? I've taken the Healthy Foundation for 2 years now. Okay. Yeah. So here's what I want you to do. I want you to write this down and then I want you to come back Thursday with your answers. Okay. Okay. So for all of the things that are bothering the arm, I want you to tell me what it feels like. Is it hot? Is it cold? Is it numb? Is it tingly? Is it sharp? Is it dull? Does it feel like hot needles? Does it feel like cold needles? Does it feel like someone's squeezing the arm? Does it feel like the arm's exploding from pressure building up inside? What does it feel like? Where do you feel it anatomically? Be precise. When do you feel it? What makes it feel worse or what makes it feel better? These are the things I need to know. Okay. What does it feel like? Where do you feel it? When do you feel it? What makes it feel better and what makes it feel worse? That's all I need to know. So focus on those things for the next 2 days, for the next day, and then come back Thursday and tell me the answer to those things. And I'll tell you what to do. Okay? Okay, very good. Is there a homeopathic or menstrual cramps? Yeah, there's like 52 medicines for menstrual cramps. There's a client who's 22 years old on the 90 plus plant minerals. She came off her birth control pills in her first month was bad cramps, and she's worried about this month. Yeah, so there's not really, well, there, remember with homeopathy, 99.999% of the time, the treatment must be individualized, right? I could have triplets, all with bad menstrual cramps. They have the same genes, they eat the same food, they experience the same stress, they all have menstrual cramps, they each need 3 different homeopathic remedies to recover, right? I can give you a Hail Mary, though, because there's a couple of homeopathic medicines, which are more um, indicated than others. So let's do this. This is a real Hail Mary. Okay, you ready for this? Homeopathic, Simisafuga racemosa in the 30C potency. Tell her to take 2 pellets once a day, starting as soon as she gets it, and then 2 pellets 3 times a day when her menstrual cycle starts. And if she gets pain during her menstrual cycle, she can take 2 pellets of the Simisafuga every 30 minutes. But she needs to stop taking it when it works. It's like a cough medicine in this regard. You take it until the cough goes away, you stop taking it. The cough comes back, you start it again. You take it for the pain goes away, you stop taking it. Pain comes back, you take it again. It's like that. This is kind of a Hail Mary. It probably has a 20% chance of success. Okay? Okay, very good. Casey from Utah is back 42 minutes. So I'm understanding you right when you say if Dr. Wallach says if we're on the full 90 and off the bad foods, then the only thing we need to eat is fat, cholesterol, and protein. Nothing else matters. Well, that's what Wallach says, but that's not true, right? There's lots of enzymes in fruits and vegetables and herbs, mushrooms. There's foods that are rich in antioxidants. There's foods that are rich in pre and probiotics. There's foods that are beneficial to the human body as far as keeping things running, right? And there's a difference between surviving and thriving. So, what Wallach is talking about is surviving. You know, if you want to thrive, then you add other things in order to round it all out, if that makes sense. It's a good question, by the way. New Brain Tree's up next. 4310. Is it okay to add some acupuncture while doing homeopathy, or will that interfere? I wouldn't do one at a time. Those are both energy medicine treatments. I would only do one at a time. Pick which one you want and stick with that. I would not do both at the same time. I'm a big fan of each of those treatments. Okay. Okay, we got a quercetin question next, 4343. How about that? I'm currently taking Vital Nutrients quercetin, 2 pills at 500 milligrams. How much can I take daily, and do you recommend any probiotics as an adjunct? Well, it depends on what you're taking it for. I'm assuming if you're taking quercetin, it's for allergy symptoms, probably. Seasonal allergies. Quercetin can lower your blood pressure and make you pass out if you take too much of it. So, what your maximum dose is going to be different than my maximum dose. And it also depends on when you take it. Are you taking it on an empty stomach? You taking it with a meal? You taking it between a meal? What's your height? What's your weight? What's your percent body fat? So, I have no idea. That's an impossible question to answer. The only way that you can hope to answer that is trial and error. I wouldn't do more than 6 a day, and I would not do more than 2 at any one time. I wouldn't do more than 2 at any one time, and I wouldn't do more than 6 a day. Because remember, it's managerial. This is not a curative treatment. This is simply managerial. So you're taking quercetin for itching. Okay, well, that's managerial. That's not curative. So remember, this is our method. You take the 90 essential nutrients, you stop eating these foods. If you do these two things, then you can take extra quercetin. But when you do it this way, this gives your body everything that it needs to fix itself. Well, mostly, at least on the material plane. And then you can do quercetin on top of that if you want to. I wouldn't do more than 4 a day of quercetin. I would not do more than 4 a day. Okay. Okay. We have about 15 minutes left. I'm going to go into YouTube because we're broadcasting live on YouTube. There are 42 concurrent viewers on YouTube. So I'm going to pick and choose a couple of questions from the YouTube audience. I don't normally do this because remember, the intention of this YouTube presentation is to promote. It's basically I'm shilling for my subscription service, uh, giving people a taste of the information that's available on my website, and the website is leavebigpharmabehind.com. It's got a good ring to it. Okay. Okay, so here we go. Jay Mausteler says, "Hi, doctor, pancreatic enzyme deficiency." So if you have a pancreatic enzyme deficiency, then it begs the question, why? And usually it's because you are out of these essential building blocks, right? So this is our first step for everything that affects everybody is we suck these nutrients down because this recipe gives you all 90 essential nutrients that the human body needs. And remember, an essential nutrient is called essential if the body needs it but can't make it. Body needs calcium, can't make it. Body needs vitamin C, can't make it, et cetera, et cetera, et cetera. There are 90 nutrients that the body needs, can't make them. And they're not in the food anymore. Quite frankly, they never were, but less and less and less and less over time. So this is mandatory. Number one. Number two, you got to stop eating these foods, period. And there's an excellent video on my website which tells you why you need to stop eating these foods. Okay? So, number one, number two, and usually just doing those two things, your enzymes bounce back. Make sense? Why? Because the human body knows how to fix itself. The human body is trying to fix itself. The human body wants to fix itself, but it needs help. It needs 90 essential nutrients, and they're not in the food that you're eating. If you are not supplementing correctly, you are deficient in essential nutrients, and something is going to break. It's that simple. It's that easy. You don't want to believe it. I don't care. All right, where are you going to get this stuff? By the way, EiffelHealth.com. Get the supplements. I don't sell the supplements, ladies and gentlemen. I don't. Get the supplements here, EiffelHealth.com. Okay. This stuff is called the Healthy Foundation Pack. So call EiffelHealth.com. Tell them you want the Healthy Foundation Pack. Okay, very good. What do you think of PEMF treatment along with your foundation pack? I don't know what that is, and I'm sorry. What's your position of iodine supplements? We like iodine. Iodine's part of the 90 essential nutrients. I'm a fan of salt that has iodine in it. I'm a big fan of seaweed supplements because most seaweed supplements are even just eating seaweed, right, are high in iodine. I'm a big fan of it. But remember, and this is not rocket science, right? This is not that difficult to understand. You don't need a PhD in molecular biology here. If your automobile runs out of oil, the engine's going to seize. There's nothing wrong with the engine, ran out of oil. If your tires run out of air, they're going to roll off the rim. Nothing wrong with the tire, it ran out of air. Your car loses power steering fluid. You can't turn the wheel anymore. There's nothing wrong with the wheel. You ran out of power steering fluid. Well, guess what? You run out of the 90 essential nutrients, shit starts to break. And it's not because you have a bad gene. It's not because you're getting older. It's not because you have a voodoo curse. It's because your body ran out of the stuff that it needs to keep running properly. Period. Hard stop. So we don't just do 1, 2, 3, or 4 nutrients. That's called fractionated nutrition. And that's what every other idiot in the world does. That's what every functional medicine doctor in the world does because they all have their heads up their ass. You want me to prove it? The next time you're in the presence of a functional medicine doctor, ask them their definition of health. What's your definition of health? I'd really like to know. Why is that important? Because if you're going to a medical professional for a health recovery, wouldn't it be prudent for them to know what health is? They don't. Functional medicine is green allopathic medicine. It's using a handful of nutrients to force the biochemistry of the body in the way that the practitioner thinks is correct. It's not curative. It doesn't support the body's ability to fix itself. It just moves things around the same way that drugs do. Now, you can argue it's better to do that than to suffer. Well, I would agree. But it's even better to try to freaking cure it. Wouldn't you think that? I would. Okay, very good. Zealous One says, thanks for doing this. You're welcome. I have full respect for ER doctors and some surgeons. That's about it. Well, I was very close with a very famous orthopedic surgeon. And I completely agree. There's room in the world for surgery, right? There is. Right? However, when you're a surgeon, like the fella said, if all you have is a hammer, everything looks like a nail. So whether you need surgery or not, you're probably going to get surgery because that's all the surgeon knows. And well, look, sometimes you need it, right? Got a bullet in your leg, you need surgery. Heaven forbid. Oh, Ballbusters is on with us. Hello, Daniel. My mother just started the Osteo FX, Brian Clark says, but is heading straight to the bathroom right after it. Don't know what to tell her. So we were talking about that a little earlier on this chat. That's a canary in the coal mine symptom. So it's the magnesium in that supplement that's causing the loose stool. But if it was the magnesium in the supplement causing the loose stool, then everybody who took that supplement would get loose stool. So it's your mother's inability to absorb it, which is the problem. Right? So that's called a pathognomonic symptom. It's a diagnostic indicator that your mother's intestinal tract is messed up. Because here's how it goes in the human digestive tract, right? The mouth chews the food up, makes it into smaller pieces, mixes it with saliva, it starts to dissolve it, then it drops into the stomach, which is a giant freaking acid bath if you're healthy. The acid in the stomach dissolves the solids completely into a liquid slurry, which passes into the small intestine. There's these little finger-like projections in the intestines called villi, and there are millions of them. And on top of the villi, there are microvilli. There are billions of microvilli. And it is the job of the microvilli to absorb nutrients from that liquid slurry that the stomach just digested. You with me? Kira, are you with me, Kira? Now, if the villi become damaged, they're not going to be able to absorb nutrients, even if the nutrients are there. Here's what damages the villi. All this shit. With an emphasis on wheat, barley, rye, and oats. Damages the villi. So as time goes by, more and more and more, it's like death by a million cuts. More and more villi become damaged. It's harder to absorb nutrients from the food. There aren't enough nutrients in the food anyway. So the more of this stuff that people eat, the harder it is for them to absorb nutrients. They become extremely nutrient deficient because there's not enough nutrients in the food anyway. Everybody's nutritionally deficient, but now they're driving that into overtime because of the shit that they're eating and they don't even know it. So your mother's villi they've crapped out. It's very hard for her to absorb nutrients, anything. So she needs to stop eating these foods. She needs to stop the osteo-FX. And I would take the supplements in extremely dilute doses, right? So the normal dose of osteo-FX is 1 capful or 1 ounce once a day. So I would give her a teaspoon of the osteo-FX 3 times a day for a week, and then 6 times a day for a week, and then 6 teaspoons in an ounce, right? Is that right? Yeah, that's what I would do. A week's probably not going to be long enough. 3 teaspoons for a month, and then 3 teaspoons twice a day for a month. Well, she's got to stop eating these foods or she's going to die. But before she dies, she's going to suffer and then go bankrupt and then die, because that's what happens in the United States of America. And I'm not making this shit up. The leading cause of bankruptcy is medical bills. Have you ever thought that one through? What's the most expensive type of medicine? It's the one that doesn't cure anything. You get it? Your medical doctor may be the nicest person God ever created, but they do not practice medicine. They practice allopathic medicine. And allopathic medicine is based on a juvenile, childish understanding of how the human body works, and the medicines that the medical doctors are trained to deliver are dangerous. They're the leading cause of death. Veronica Kolick likes pulsed electromagnetic treatment. So do I. You should read this book if you haven't already. Healing is Voltage. This is by Jerry Tennant. Healing is Voltage by Jerry Tennant. Healing is Voltage by Jerry Tennant. It's a very interesting book. Okay. Thank you, Dr. Glidden. You're the man. Yes, I am. Okay. Very good. Thank you for your honesty. Well, you're welcome. Okay. Okay. Oh my God. Yeah, this is me after vacation, right? I guess. All right. We should do a baby pool. How long is it going to take for Dr. Glidden to be censored? Let's start taking bets right now. I don't know. But in the meantime, please go to the website, become a subscriber. You don't know what you're missing. We don't know everything, but we know a lot. It's science-based, clinically verified, and based on natural law. And that's a good start, wouldn't you say? Oh, by the way, here's the working definition of health that your medical doctor is completely unaware of. Health is the ability of a living organism to experience negative stress and remain symptom-free in a state of dynamic equilibrium. Symptom-free in a state of dynamic equilibrium. Let me say that once more. Health is the ability of a living organism to experience negative stress and remain symptom-free in a state of dynamic equilibrium. It is your birthright, and you should align yourself with medical professionals who know how to help you secure it. I am one of those. You know who I am. Dr. Peter Glidden, your steadfast advocate for medical freedom and curative medical therapeutics. Thank you for your trust. Thank you for your time. I hope you learned a thing or two. God willing, and the creek don't rise. I will see you in 2 days at 11 a.m. Central Time. Until then, live long and prosper.